Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to share with you the number one worst thing that you can do after knee replacement surgery. Before I jump into that, please be sure to hit the subscribe button, turn on the notifications so you can catch all of our latest videos. So by far the worst thing that you can do after knee replacement surgery is excessive amounts of rest, being excessively sedentary, not moving your knee, not moving your body. And I mean this, I'm talking about the knee itself, so excessively resting the knee, propping it up on the bed, on the couch, and not bending it, not moving it. And I mean this about your body in general, not getting up, not moving, not doing some exercise, some activity, some walking, and just laying there and being sedentary. And why we do this is we feel like we need to give our knee and our body time to heal and recover. And the best way to do that is to rest and to not do too much activity and not overdo it. We don't want to damage our new knee or damage things that are healing. We don't want to cause too much pain for ourselves and too much discomfort. In the same way, we think that might mean that we're causing damage or injury. And we think that the body and we think that the knee needs this rest for healing. And we feel exhausted and we feel low motivation and we don't feel confident in walking or standing and doing all these exercises by ourselves. So we rest and we do a lot of very little and are very sedentary. And this can be a problem. Now I'm not saying don't rest at all. Rest is an important part of your rehab and recovery. But if all we do is rest and sit on the couch and don't move the knee and don't move our body, we're going to have a lot of problems. So first off, at the knee itself, you're going to develop a stiff knee. That knee is developing scar tissue as it heals and recovers. And as that scar tissue forms, it's going to become very stiff, it's going to become very tight. And so if you aren't working to restore your range of motion, your bending, your straightening, your movement of your knee, and you just let it rest there and aren't doing anything, then that stiffness is going to come and you're going to have a loss of your range of motion. You're going to have a very stiff, very tight knee. And it's going to be very problematic, one, for your function to be able to do what you need to do. It's going to be painful and uncomfortable. And you're possibly and likely going to need some other forms of intervention, if that's a manipulation under anesthesia, maybe even going as far as needing a revision surgery. So that's the knee itself. The other problem is with your body and not moving your body and being excessively sedentary after surgery. And this is going to affect your overall health. You're going to be at a higher risk for developing blood clots in your leg. You're going to be reducing your strength and you're going to lose muscle strength at a very rapid rate. You're going to reduce your aerobic health, your aerobic endurance, your aerobic capacity. You're just going to have a decrease in function and independence overall, and it's going to be harder and harder to kind of get out of that depression of your physical abilities. So what can we do about this? Well, prevention is the best treatment. We need to be moving, we need to be functional, we need to be active after knee replacement surgery. Now we're keeping this relative, right? Excuse me. We don't want to overdo it. We want to work back into things progressively, but we need to be doing our physical activities, our physical therapy activities. We need to be doing our walking and getting up and standing. We need to restore with a measured amount of stress on the body to restore strength, to restore range of motion, to restore bone health, for the body to heal and recover, and most importantly, to get your symptoms under control and to get back your function, your mobility, your independence. So slowly, progressively increasing our activity, doing it in a controlled, guided way, but not being completely sedentary, not resting. That is actually some of the worst thing, or is the worst thing that you can possibly do for your health and your recovery after surgery. So take-home message very simply is rest and resting your knee, resting your body is important after surgery, but we have to fit that in with doing the exercises, doing the physical activity, getting up and standing, getting up and walking to build back our strength, our mobility, and for the body to heal and recover, and for the knee to get adequate mobility and function as well. I hope you found this video insightful. I hope you found it helpful. Please be sure to leave your questions, your comments below. Please be sure to hit that like button to help spread this video. Thank you very much for watching.